I'm a doctor, and what I'm about to tell you could protect your memory in ways you didn't expect. A large study published in JAMA Internal Medicine found that long-term use of certain common medications may increase the risk of dementia by up to 54%. Not rare drugs, not experimental treatments, everyday medications. The kind millions of people over 60 take every single day. Sleep aids, allergy pills, anxiety medications. I've personally seen patients who were told they had early dementia, but after reviewing their medications, it wasn't dementia at all. It was medication-related cognitive impairment. And in some cases, when we adjusted those medications, their memory improved. So, before you assume memory loss is just part of aging, you need to watch this carefully. This video is for educational purposes only. Always consult your doctor before making any changes. Why the aging brain is vulnerable. As we age, the brain becomes more sensitive to medications. After 60, several important changes occur. First, blood flow to the brain gradually decreases. This can reduce oxygen and nutrient delivery, making brain cells more vulnerable. Second, the blood-brain barrier becomes less effective. This barrier normally protects the brain from harmful substances, but with age, more medications can cross into the brain. Third, levels of key neurotransmitters decline, especially acetylcholine, which is essential for memory, learning, and focus. Now here's the concern. Many commonly used medications interfere with these exact systems. Some reduce acetylcholine, others slow brain signaling. Over time, this can lead to symptoms that look like dementia, but in some cases, it may be medication-related cognitive decline, which can be partially reversible if identified early. 9 medications linked to memory issues. Let's go through them carefully. You may recognize some of these. 1. Benzodiazepines, anxiety or sleep. Examples include diazepam, alprazolam. These medications slow brain activity. According to research published in BMJ 2014, long-term use has been associated with an increased risk of dementia. The American Geriatric Society also advises caution in older adults because of risks like memory impairment, confusion, falls. 2. Anticholinergic drugs. These are extremely common, found in allergy medications, cold remedies, bladder control drugs, some sleep aids. They block acetylcholine, a key chemical for memory. A major study in JAMA Internal Medicine 2015 found long-term use was associated with up to a 54% increased risk of dementia. This is one of the strongest medication-related links we have. 3. Sleeping pills, Z-drugs, such as zolpidem. The FDA has warned that these medications can cause confusion, memory problems, increased fall risk in older adults, especially when used long-term. 4. Opioid pain medications. These medications slow the nervous system. According to CDC guidelines, they may cause sedation, cognitive slowing, reduced alertness, especially in older individuals. 5. Statins, cholesterol medications. Statins are widely used and beneficial for many people. However, the FDA has reported that some individuals experience memory loss, confusion. These effects are generally reversible after stopping the drug. Evidence is mixed, but awareness is important. 6. Certain antidepressants, especially older types like tricyclic antidepressants. These can have strong anticholinergic effects, which may impact memory, attention, mental clarity. This is noted in the Beers criteria for older adults. 7. Antipsychotic medications. These are sometimes used in elderly care. However, they carry an FDA black box warning. Increased risk of stroke and mortality in older adults with dementia. They can also contribute to faster cognitive decline. 8. Some blood pressure medications. If blood pressure becomes too low, brain perfusion may decrease. According to research in Hypertension Journal, low blood flow to the brain can affect cognition, alertness, memory. 9. Proton pump inhibitors, acid reflux drugs. These are very common, but long-term use has been associated with vitamin B12 deficiency, and B12 is essential for brain function. Research in JAMA Neurology 2016 suggests a possible link between long-term use and cognitive decline. Warning signs. So how do you recognize the signs? Watch for sudden memory loss, confusion in familiar places, difficulty finding words, feeling mentally foggy, slower thinking, mood or personality changes. Here's the key. If these symptoms started after a medication change, it may not be coincidence. It may be a signal to review your medications. Safer approach. This part is very important. Do not stop medications on your own. Instead, speak with your doctor. Ask about safer alternatives. Review all medications, including over-the-counter drugs. Ask specifically, does this medication have anticholinergic effects? Support brain health naturally. Quality sleep, balanced diet, light physical activity. Sometimes, the safest approach is careful optimization, not simply adding more medications. Real case. I once worked with a patient, 67 years old. Her family believed she was developing dementia. She had memory loss, confusion, difficulty navigating familiar places. But after reviewing her medications, we found multiple drugs affecting cognition. We worked with her physician to adjust them safely, and over the following weeks, her symptoms improved significantly. This highlights something important. Not all cognitive decline is permanent. Some causes are treatable. If you found this helpful, comment below. Are you currently taking any medications? And if you're over 60, it may be worth reviewing them with your doctor. I've also created a simple checklist. Medications that may affect memory after 60. You can find it in the description. Because protecting your memory means protecting your quality of life.